You have
And
to
that's,
have that kind of like,
you have to have somebody that's fighting for your money, because if you don't, the insurance carriers, they don't care to deny. They don't care. They'll deny all of your stuff and wait for you to give them proof that they should pay it.
they will. Exactly. Welcome back to my channel, everyone. I have a special guest with me today, Ruby Simmons. She is the owner of Blossom Revenue Cycle Solution in Massachusetts. Thank you so much, Ruby, for joining me today.
Thank you so much for having me. I'm so excited to speak with you today.
Yeah, thank you. I'm so happy to talk to you too. And I've been looking forward to speaking to you for a while.
Oh, I am too. I'm so excited.
So tell me a little bit about your services and what you offer over at Blossom Revenue Cycle Solutions.
So we offer a wide range of services, but I'm focusing right now on helping practices with their implementation of telemedicine, especially now, with COVID-19 going on. I'm finding that a lot of doctors they're confused, and they're not sure which way to go and what software to get.
Yes.
And they also don't really have the time to do the research. So I'm the type of person where I do type of research and help providers implement new services that they need within their practice.
Awesome. And I know your experience level, I mean, you've got a ton of experience, and you're not just like an experienced medical biller, which is great, right? You are a revenue cycle manager. Like that's really where many of your years of experience come from.
So I have 26 years experience in healthcare. I have at least 10 to 15 years of that is medical billing. I've done both hospital and professional. And in the last 10 years, it's been more revenue cycle based. I focused on everything from the beginning to the end, making sure the process flows and the money comes in, including denial management, front end training, systems management, budget management, and helping small private practices create new business. So last thing that really came into my career was systems management, where I understand systems. So I can help create processes on properly registering patients and processes and workflows for properly following up on charges.
Awesome. Yeah, I talked to a few people because a lot of people are starting medical billing businesses and they are not really in a position to run the medical billing business, but they are looking to hire people to like open a business. And I always tell them that I want you to obviously hire medical billers who need, who can help you, but it's important for them to look for a revenue cycle manager to bring in first. And then for that person to then help them hire the medical billers and
That's right.
and coders that they're going to need, because the revenue cycle manager just has a level of experience that's just top notch. It's really what you need to flow smoothly.
And understanding the entire operations and what you'll need.
Exactly.
Definitely, because it's important to, I know a lot of people just say, you can be a biller. It's easy to get into being a biller. And yes, it is. But there's a lot of other things that you need to learn as a biller that a lot of people do learn on the job. But if you don't have a manager or someone that can put processes in place for you and train those people, you'd probably be losing a lot of money on the back end.
Yes, definitely. I was looking at your website and I noticed in your specialties, you are full cycle. So, you do it all, but is there one particular specialty that you like to focus on?
Currently, I'm focusing on dermatology and behavioral health. I can do all specialties. I have a lot of experience with orthopedics.
Oh, nice. Yeah, that's a hard one. And I get a lot of people
It's a
who
difficult
ask
one,
about that
but
one. Yeah. It's not a lot of people out here that have that kind of experience. So I spoke to a couple of interviews prior to you, and one did behavioral health and the other did was multi-specialty, similar to you. They were all pretty much multi-specialty, but they specialized in certain things. And I thought that it was interesting. So that's why I wanted to really talk to you, because your experience level allows for that multi-specialty and for it to get done in an easier way, because you've just got that type of experience.
yeah.
what are you experiencing now with this current situation? Because I understand you said you were really focusing on the telehealth portion and getting providers fixed up with that, because that's still giving them, a lot of providers around the country, a lot of problems, like the telehealth issue, and a lot of their employees, like their internal medical billing people. So what have you noticed in that industry? Any tips or tricks or something that they should know about or understand when it comes to telehealth?
What I have seen is that a lot of providers are not offering telehealth because of fear.
Yes.
They don't understand it. They don't know how to get it started, and they stay stagnant because they're not exactly sure how much this is going to cost me. Now, if you're a private practice and you're a single practice provider, you can start with almost zero. All you need is software and a process for your patients to be able to contact you, an easy process. And for larger facilities, you need to have a private room where you can speak to patients. So if you're actually in your practice, but you're not seeing patients, as long as you have a private room where you can do telehealth with patients, it's really important just for privacy.
Right.
And the software is not expensive to use. There are some free softwares out there that doctors can use personally, that can go on their phones, their laptops, and their computer systems. Mm-hmm. So that's one of the things that I'm finding a lot, is just confusion and fear around the whole thing of implementing it. And some doctors are also afraid to implement it because they're afraid that later on, when auditing happens, that they might get in trouble because they billed incorrectly, and they don't want to have to pay that money back. And they're right, because after all of this ends, there will be high volume auditing coming out of CMS.
Yes, yeah, for sure.
So it's important for doctors to know that they need to keep track of everything they do. They need to keep records of everything that they do, and they need to make sure that they understand how to bill properly.
And that's a good point, because a lot of physicians and doctors and practices who are thinking, I'm just going to put this in the hands of my internal medical billing team, or I'm going to do it myself. It's like, when this ends, like you said, there's going to be a lot of auditing, and it's important that they get the right people in place to do this now, because what you think you're spending or saving on the front end, trying to either do it yourself, or you're not willing to get an source biller like yourself with this type of experience, you're going to pay on the back end. And so you want to look at these professionals out here, and there are plenty of them around like yourself, who will put them in a position where when the audits do come, they're not going to get hit in the pockets, because they're going to get their money back if something was done incorrectly.
And they also are experiencing fear around all of the changes that have been coming out of CMS with telehealth, because they came out with something in February, then they came out with something else in like April, and then May, believe it was like May 30th, June 1st, they really came out and solidified more information and was telling all of the providers how they should bill for telehealth. And some things changed. And they even implemented where they are covering more specialties, and more providers are being able to bill telemedicine. So if you're one of those providers that right now you can bill telemedicine, take advantage of that. Sit down and brainstorm on how you can help your patients through telemedicine. And that's everything from checking their medications with them through telehealth, to helping them to look at a sore or some kind of growth on their skin as a dermatologist. All you need is a really good picture and a really good camera, which Apple has really good cameras, so does Samsung. So
cell phones, yeah.
So, yes, you can submit that type of information and keep it in the patient's record and bill for those services.
Right. And remember, a lot of them don't realize that a lot of it was deregulated, because at first you used to have a certain type of equipment, and you had to have been rural, and now all of that none of that really applies anymore.
I'm more lenient right now. So, right. If you find that in March, CMS said bill this way, and then came May 30th, they said, oh, we want you to start billing this differently, and it's going to go back to March 1st. You need to have a billing specialist that understands that now they're going to have to go back to March and April, fix your billing and resubmit it so you can get that money in.
Right.
So some doctors are suffering from getting denials because they billed incorrectly in the beginning.
Right. And a lot of that was done because I don't know, it's hard to get in the minds of a provider, but sometimes I talk to them, and just my experience kind of working through some of the problems once they come to my company for help is that they thought they were saving money, or they thought it was not, that it could easily have been, an internal biller, not a revenue cycle manager, but just somebody that they hired and kind of trained on the job with the 4 or 5 codes that they normally use would be able to do this for them and figure it out. Mm-hmm. And they already were thinking in their heads that my income is down because of the pandemic. Mm-hmm. So I don't want to spend extra money. I don't want to get a professional in because my income is down. But that's where it gets you, because you end up have already losing the money because of the pandemic and paying more because of the mistakes, because you didn't take precautions in terms of getting the right people in place at the right time. Mm-hmm. So yeah, it's an interesting point that you brought up.
And one of the other things a lot of, I think doctors should take into consideration, especially if they're multi-practice, is your old AR.
Yes.
Who's following up on your old AR during all of this that's going on? Who's still following up on it? Who's making sure that your money is coming in? I think that a lot of doctors don't realize that insurances play games. Mm-hmm. And they know when you're not following up on your services.
Yeah, that's a good point.
Just like you as a bigger organization, just like bigger organizations monitor what the insurance carriers are paying them.
Yes.
Looking at their AR. Insurance carriers are monitoring you as a doctor and looking at what they're paying out to you.
Right.
So they can tell when you are a provider that is not following up on their charges, and they will deny all of your stuff and wait for you to follow up on it. And if you don't, you lose that money.
You know what? That is such a good, I've known that, but that is such a good tip. Like, I don't think a lot of people understand that, especially practitioners. Like, oh my goodness, like they know. So all they have to do is just assume that you're not going to be able to do it like you haven't in the past. And then you will run out your timely because you have a pattern of doing that. Oh my goodness.
And so I'm a really tenacious type of person. So for me, if I see that they're not paying, I'm going after it. As a biller, it was always like, this is my money. I'm going to get my money. I know that's kind of bad, but that's my that's my nature. I like to research and dig and find out, well, what's going on that you're not paying us, and that every time we build this particular code, you're denying it. And I'll dig. I will call 5-6 times, get a different person. I will even escalate and say, can I speak to a manager or a supervisor? Or is there anyone else in your, like somebody in your IT department that can help me understand why your system keeps doing this?
Right. That's what's needed. You have to have that kind of like.
You have to have somebody that's fighting for your money, because if you don't, the insurance carriers, they don't care to deny. They don't care. They'll deny all of your stuff and wait for you to give them proof that they should pay it.
They will. Exactly. I noticed that you have a lot of, you also have hospital experience too. I know that you do a lot of consulting, and you do things like that because you help people with these types of issues that they might not even have thought about, and you help their internal crews. If you were speaking to someone who is the CEO or the manager of a hospital, and they're having issues in terms of these types of things, what would you say in terms of the cycle, like the management of the cycle that would help them, that you've seen in your experience, that they might not be, either they know about, but they're probably not paying attention to, but they really should, based on your experience?
In my experience, I found where there were hospitals who were losing a lot of money.
Oh, yeah.
I mean, I've said like literally hemorrhaging money. They lacked vision. Yeah. They had no vision for growth.
Yeah.
They had no vision on how to properly run their collections office or their finance department. Some of them call them finance departments. But within their billing department, they lacked a vision of how they wanted to run. So when they come up with issues and there's multiple issues, they lose track and lose sight on what processes they need to put into place to get that to flow. You can't do it all at one time. It's going to be a project. You have to find the areas that are most important. And it always starts with looking at your denials, seeing what it's denying for, what information is missing, and cleaning that up and creating new processes and workflows and training your employees.
Yes.
Train.
Train.
You have to train them, because you know that healthcare change, boom, boom, boom. Yeah. And if you're not training your people, they're still doing their processes the way they did 10 years ago.
Right. Very true, especially in hospitals.
Right. So if you're lacking vision and you're not training your people, then your people can't give you the type of work that you need in order for your practice or your organization to grow.
That's such a good point. Like I never even really thought about, now that you say it, it makes total sense. And I remember seeing that in plenty of times, but I never really thought about, like, it's the lack of vision that keeps these things so complicated and keeps us these bottlenecks popping up everywhere. But when you say it like that, you're like, that's true, because if they had that and they're really serious about that plan and that vision, then it wouldn't have been too hard for them to get the processes and the training in place. But the vision has to be there.
Training is so important. Customer service, like, I really feel like customer service kind of died.
Yeah. Oh, definitely.
Yes. I don't know when it died. It's been gone for a long time. And I thought that with this new accountable care, that it would get better, because we're more focusing on the patient.
Yeah.
And the patient getting the care that they need. But you rarely hear people even talk about customer service or training. Or training. So it's like, if you're not focusing on having people who can build a community, because customer service helps to build your community. It keeps your patients coming back.
It does.
You know, and then you're not training your people are not going to understand how to deal with the patients. They're going to always be afraid to ask the patient questions. Because that's one of the biggest things that I find in organizations and with private practices, is that the front end people, don't like to ask questions to the patient. And there's 3 major questions that you should always ask a patient, whether it's on the phone or when they're at the front desk and they're coming for their appointment. You ask them for their most recent insurance card. You ask them for a picture ID with their address. And you ask them if they have started a new job within the last couple months, or from the last time they were seen in that office.
Right.
That gives you all of the information you need to put into the system, so you're not constantly asking the patient for the information, or you're not standing there interviewing the patient.
How many millions of dollars do you think a hospital loses because that stuff isn't done? Even clinics.
So much. They lose so much simply because the person at the front didn't update the demographics the way that they needed to be updated. It wasn't. You find that you fix a lot more on the back end as the biller, because the front end just didn't take the time to really get the information right.
Yes.
And that holds up your money.
It does. You know? And I think a lot of people,
the claims rate really goes down when you have people on the front end that's not asking those questions and not updating. And you want your money to go out as fast as possible and come in as fast as possible. You know, Medicare, if you have large Medicare, 45 days Medicare pays, you know, and you don't want to mess around with Medicaid, because Medicaid, you want them to hurry up and pay, because they take forever to pay.
Right. You know, and I think people always want it to be super complicated, the medical issue. You look at your $2 million in AR and your $5 million in AR, and you want it to be, maybe you need it to be complicated because you don't want to admit that it was just a couple of questions on the front end that have caused you millions of dollars in AR.
Yep.
Yeah. So it's like sometimes it's really not that complicated. Is it a little harder in terms of more detail and more effort? Absolutely, but easier as in terms of the whole process.
Mm-hmm.
And
It
that's
is
where, you know,
definitely.
yeah, and the revenue cycle management, that's where it comes in, because you are always thinking about that. Because the
Mm-hmm.
biller may only think about specific things. I've known billers who were technically billers, but
Mm-hmm.
were on payment posting for a year,
Mm-hmm.
you know, but they're billers. They went to
Mm-hmm.
school for billing. Their title is billers, but
Mm-hmm.
they are on the payment posting. They are on the AR account. They are on the patient collections, but they're not looking at the whole cycle because they don't have to. They've got them in little areas.
Mm-hmm.
So that's why it's
So
like,
billers nowadays, it's just been like, uh, they do a little bit of everything
yeah,
because they're on the back end. So, like you were saying, they need to know payment posting because sometimes things get posted wrong and they need to fix them.
they
They need
do.
to know a little bit of coding.
But the problem with the hospitals or some of the clinics is they will just keep them right there. So
Yeah.
it's like they will lose. You need to constantly be looking at the cycle and be dealing with the cycle. And if you're not, if you're not allowing and retraining and having systems in place for your billers to be able to funnel that cycle and learn and be really experienced with that cycle, you're going to have issues. And that's fine if you've got the staff, but you need a revenue cycle manager above all of that to be making sure that even though your actual billers are not looking at everything, your cycle manager on top is keeping track of everything.
Yep. And it helps because you can also look to see where the billing team might be lacking
Right.
in experience
Yes,
or getting to your AR in a timely manner.
exactly. That's really good.
Because
That's really
some billers, they're having difficulty with the volume
good. Yes.
volume of work that they're getting.
Oh yeah.
So you need
Lots.
someone that's able to look and say, well, Tanisha's having a hard time keeping up with her volume. What other ability do we have that might be able to assist her in cleaning up her billing so that she can handle it and manage it more?
Right.
Because that happens, billing gets out of control sometimes.
Oh yeah. Oh yeah, for sure. So what is the process? If I'm a provider or a clinic manager and I'm interested in your solutions, and I'm going to go with her. She knows what she's doing. What's the process of intaking your clients? How long does it take for you to get off of the phone after the contract is the service agreement is signed and getting you set up for the billing?
It really just it comes down to how fast uh, the organization can get me access to their information.
Okay. Yeah.
So the faster you can get me the information I need to get access to your systems,
Mm-hmm.
to get access to your portals that you utilize. It could take anywhere from a week to 2 weeks. 30 days is the longest.
Right.
That it really should not take 30 days.
It shouldn't take
But
30 days.
sometimes you know people are busy and it
Yeah.
just takes a minute to get you information.
Yeah.
But that's the time frame.
Right. I've had a couple of clients who they held up the paperwork on their end, so it did take around that time. But yeah, so that's like maximum. But that's good to know, about 2 weeks to 30 days, depending on how fast they get it to you.
Mm-hmm.
Awesome. So I know you've transitioned from hospitals to doing your own thing in your own business. What do you think is the benefit of bringing an established hospital with an established in-house medical billing team, bringing somebody like you and your company on board, in addition to what they've already got in place in their hospital or their clinic?
Oh, definitely. As a consultant, I would be able to help them find where they're losing that money.
Yeah.
And I would also be able to help them understand what processes they need to put in place to help their team basically collect on the revenue better. Like, where are you losing your most revenue? What are your top 5 denials? How do you fix these top 5 denials? How do you recognize missing charges? And how do you help the front end with getting the information that they need from the patients and putting it into the system? So it's more so management of the whole revenue cycle and helping you to keep it clean and or put processes in place that makes it easier for you to follow up on your money.
Yeah.
Let's just say AR.
I love that, because sometimes you'll have a big system, like you'll be a hospital or a clinic or a major clinic, and you've got a big department, but you're in a tornado.
Yes.
Sometimes you need that outside help to come in and go, okay, I get it, I understand, but 1, 2, 3. And so I see why you kind of went out, because you are more effective on the outside coming in, because the people in place are just they're doing the best they can, and they may be highly qualified, but
it's overwhelming. It does.
Right.
And once you get to a point where your your bad AR is really high.
Yes.
And your bad AR is the stuff that you feel like you can't collect. So there's still money in that bad AR that you have sitting there. The AR that you're thinking you're going to end up having to write off and take off of the books because you can't collect on it. There's still, if you have someone that's willing to follow up and fight for that AR, that money that you have sitting there, you can still make money on that old AR, even after 3 months. Because if you've built things correctly and you feel like it was something that the insurance was doing wrong and they just haven't corrected it, you can still fight for that money. Yes. And bring it in. And then you can also show what you learn from that bad AR is what you don't want to do and how to fix it. So that brings down, you get whatever that money is that's old and you want to get off of the books, you can get what you can out of that. And then you can create a process from that for your billers and your coders and your patient access people to put into place so that you don't continue to make those mistakes and you end up at the end of the year writing off millions of dollars because you didn't follow a particular process.
All right. Yeah, that's a really good point. So this conversation was wonderful. There's so much good advice in it and so many good tips available. And you've provided so much insight that normally, a lot of people don't see or hear. So how can a provider get in contact with you and start the process with bringing you on board to be their outsourced medical billing company?
They can contact me at blossomrcs.com. That's BLOSSOMRCS.com. And click on book a consultation. And there is a tab where you can click on to book the free 30-minute consultation or a practice analysis. And there will be questions that you need to answer to help me get a little bit of an understanding of what you want to talk about and review when we do this call.
So you're located in Massachusetts on the East Coast of the United States, but do you see clients nationwide as well?
Yes, I do.
Perfect.
I also travel to clients and to help assist them in looking at their processes and even their systems, because I do have systems management experience as well. Right now with COVID and everything going on, I'm trying to keep that to a minimum.
Yes. Okay, great. So you do offer a travel consultant option as well that they can utilize if they want you to come into the office. All right, awesome. So that's your contact information down below as well in the description box. Thank you so much for taking the time to interview with me today, Ruby.
Thank you so much for interviewing me. I really had a great time. This was wonderful.
Awesome. Okay, guys, thank you for listening, and I'll see you at the next one.
Bye.